Hi, everyone. My name is David Adams. I'm an assistant professor at Cal Poly Humboldt. Located in Northern California, and today I'd like to present on structured playgroups for children with autism spectrum disorder, what we know and where we can go for the field of physical education. I hope that this presentation allows you to better understand how you can adjust your own programming to meet the needs of all your students in the class, especially those with ASD. So it's important that we kind of go in a structured system within this presentation. So I'd like to follow the outline that we have here, talking about legislation, evidence-based practices, data-driven decisions, what are structured play groups, how they were determined as an evidence-based practice, what we currently know, and then how we can go about moving forward as a field and within your individual schools. So in the United States, we have a national law that protects students in special education, protects all students, but specifically those in special education. So IDEA was signed into legislation in 2004. It protects children from 0 to 21 years of age. It also requires teachers to screen children for identifying a possible disability. So if a teacher was to screen their children in physical education, that might just be observing students within the first couple of weeks and identifying students that might need some additional assessment. That's what we call our child find. And once we have done that, we would request that the child has further assessment. And so IDEA also identifies specific disabilities that can be, they don't have to be, but can be assessed for special education services. So one of those disabilities is autism spectrum disorder. The most important feature of IDEA is that all children receive free and appropriate education. So we all know that means that if one child gets 30 minutes a day of physical education, then all other children should get those same freedoms or same benefits at the school. It also requires that children are placed in the least restrictive environment. And hopefully within this presentation, you'll see how structured play groups allow for children to be placed in an environment where they can learn from others and others can learn from them. It also has parents' protections and rights. So before we can go into any type of assessment, there's procedural safeguards that mandates that, or that says that parents must be aware that there is an opportunity for further assessment, and those parents must they must agree to those assessments. So a lot of things in IDEA, but overall, we're protecting the rights of students with disabilities in the schools. So also, when we get to evidence-based practices, we know that evidence-based practices are high-quality, scientifically based research that implement appropriate designs. And some of those group designs are group designs, random control designs are really big, but we also have single case designs that are used predominantly or a lot in the schools because we have students with low incidence disabilities such as autism spectrum disorder. And what really evidence-based practices do for us as a field is they identify for teachers what works, so that we know that when a parent comes into us for an IEP meeting, or that we're reporting back what we've done in the classroom to other teachers or administrators that we work with, we can say, look, we did this because there's scientific evidence that this information or this strategy should be used. And so structured play groups is part of those evidence-based practices. And it was in 2014, the National Professional Development Center on autism spectrum disorder identified structured play groups as an evidence-based practice. So data-driven decisions, obviously in the right side of this PowerPoint, we have two types of different single case designs. And really the reason I wanted to show this is because when you go into a meeting with whether it's other teachers, administrators, parents, you want to show data. And it's the most powerful thing we can do is to show what their kids are doing in the classroom. And just think about if you've ever been to an elementary classroom, teachers have loads of data, and data can be homework assignments. It can be assessments you use like task analysis, rubrics, so informal assessments, portfolios of students, all this stuff. But what it does is it creates data that we can show parents One of the biggest mistakes I think we make as physical educators is not bringing enough data when we are demonstrating what students have done in our classroom. So what we mostly do is follow 6 or 7 steps, and we go through observation, where we look at the student. We use data collection, where now we're starting to use some type of assessment. Off of that, we design interventions, and then we analyze that data or the performance of the students on those interventions. That intervention for this one would be structured play groups. We start reporting data to not only students, but also to parents and staff and administrators. And then we reflect on that data, and then we make decisions moving forward. Structured play groups. So really what they are, they're very similar to peer mediated instruction. The only difference, real difference is that in structured play groups, the teacher or the researcher is closely situated within the activity to make sure that the specific details of the group are happening, such as making sure that the students that are working with the child with ASD are providing specific prompts or the correct prompts, that the child with ASD is given every opportunity to be successful. So structured play groups, like many interventions, are based around mass amounts of activity, again, under that direct supervision. That's where they differentiate from peer mediated instruction, where the teacher was not directly aligned with the group in some of those settings. We talked about earlier that the NPDC, or National Professional Development Center, had identified structured play groups as an evidence-based practice. And so when we go into the classroom setting, we look at how we can design classrooms in least restrictive environment. So we look at learning domains, whether psychomotor domain, affective domain, or cognitive domain. Well, think about for the student with an ASD, where they have modeling from their typically developing peers. They're learning there. The typically developing peers are also assessing the child or children with ASD. So they're learning how to assess and identify correct movements. But the child with ASD is also doing that same thing. So we have psychomotor development there, and we also have cognitive development that can happen there. And then you have affective domain, which is students taking on self-responsibility, social responsibility, and group responsibility. So in all 3 of those instances within structured play groups, it happens because individual responsibility is happening when the student is actually performing the behavior that we're asking for. The social responsibility is hopefully that this is where we're working on maybe getting the student to respond correctly or initiate the request to play. And then the group dynamics is playing appropriately. And that could be responding appropriately to winning or losing, or to feedback that is given. Structured play groups are great for reversed inclusion. That's where you're actually bringing typically developing students into a special ed classroom. But really, that word awareness is really important, because until we get our students to understand disability, our typically developing students to understand disability, there's a big opportunity for students to be shunned away or not accepted into a group play, where if we can build that awareness and understand that the benefits that every child brings to the group, I think there is a better chance for groups and all children to be involved. And then also, it's a structured system of learning, which we know is great for all children, but especially for children with autism, as some children deal with difficulties in transitioning or difficulty with changes in their schedule. So a structured system of learning where they know who they're getting their direction from, how the direction is being given. All these things are great benefits of structured play groups. So what we know, a key feature about structured play groups is the inclusion of trained, typically developing peers. And there's not a set time period for the training. Some studies have gone to as little as 3 days at like 15 minutes each day. Some have gone up to 6 weeks. It really depends on what you're asking the trained individuals to do and how much training they actually need. But many of the structured play group, for the research that's been done, they've tried to improve communication and reduce social skill difficulties. So that's what we're seeing. There has not been thus far a lot of research that's looked at the performance of like a gross motor skill. So I think there's a strong research area or a need for that moving forward. but structured playgroups are a structured teaching approach that utilizes observation, training, scaffolding of instruction, and multiple opportunities for success. So the scaffolding of instruction could come from the lead teacher, and multiple opportunities for success. That's that mass amounts of opportunities. Okay, so we know that the results from the research that we've seen, results point to the promise of integrating a reverse inclusion style classroom where the typically developing peers are brought into a special education classroom to work with their peers with the ASD. So while that's been shown, there also is evidence that shows that structured playgroups can work in a general PE setting. And we just need more research to go in that direction. All right, so moving forward, children, including those with ASD, have the opportunity to learn important skills from the observation of others. I mean, you look at social learning theory in Bandura, children learn from watching others and the reinforcement that's given for those behaviors. So think about a child performing a correct skill, whether it's the rest of the students in the class applauding that behavior or maybe giving that student a high five. Students with ASD are learning that this is the appropriate behavior that's expected of me, or this is where I get a positive reinforcement. So there's a lot of social learning that goes through structured playgroups. Physical educators can build on previous knowledge of structured playgroups through following a structured pattern of learning. That's when we go into training our typically developing peers. So there is a structured set to the class. Building appropriate assessments. I think, for any student, any up and coming general PE teacher, the importance of understanding informal assessments and alternative assessments such as task analysis, rubrics, portfolios, anything that you can collect from the student, videos, all this stuff is great. Collecting consistent data, and that's where I showed in the past graphs the single case design studies. If you're interested, I would greatly encourage you to understand single case design, because it's a great way to implement an intervention and consistently collect data for your students. And it's consistent data. And then speaking with the participants, we all know that we do not, I myself do not have ASD. I should not be making all the decisions for my students. So speaking with our students, asking them, what would you like to do? How would you like this setting to be? Who would you like to work with? Giving them a voice, so that we're not just pairing them with a student or students that they might have some type of social problem with. And that's really important when we pick our peers, to making sure that the trained peers that we're using already have demonstrated really a sense of understanding of the difficulties that the child or students with ASD have, and they're willing to maybe move a little bit slower or accept that they're not going to be possibly performing the skill at the same way that other students might perform it. So it's just a differentiated learning, different way of learning that they're going to have to get accustomed to. So structured playgroups, what it could look like. There was a nice study by Harper and Simon in 2007. They had 8 to 10-year-old children, 8 to 10 years of age, 2 with ASD, and then 4 typically developing. So what they did is they matched each child with ASD with 2 typically developing participants. They ran a multiple baseline across participants. So they had the 2 participants. And then they worked in an indoor classroom and a recess area. Their intervention was the peer buddies and the work that the peer buddies did. And what they recorded was, or the outcome that they were looking for, was the time in play. So again, you can definitely go into the article itself to go deeper into what happened, but you can see what kind of data you would be presenting to your parents. And a multiple baseline is one of the strongest types of single case design that you can use. And so it creates that data that we can go in and show to our parents and really validate what we're doing in the field. And there's so many times where I think PE is used as kind of a time filler during the day, where expectations may not be as high, or academic expectations might not be as high, and students are kind of allowed to just go through. But when we start collecting data and showing students that data and motivating them to perform based on the data we're collecting and working with them and telling them, hey, here's the goal we want to set for you. Do we think we can do this? Here's the time we want to get it by. Now we start really involving the student in the development of the class and the intervention we're doing. And so they have buy-in, and we all know that buy-in is a huge thing for students, because if we don't have them connected to what we're doing, it's even more difficult to get them involved. So with that, I want to say thank you again for allowing me to present. I hope this presentation has shed some light on the intervention of structured playgroups. There's so much more out there, and if you can just go on Google Scholar, you can simply type in structured playgroups, or you can go to the National Professional Development Center on Autism. You can look right in it. They have a whole tutorial or a module that you can do, and you can learn more about it. So again, I thank everybody for allowing me to present, and hope that this information helps you moving forward in your field.